Hi, I'm Dr. Nick, and I'm the Incrementalist. Today we're talking about aspirin. It's been around for hundreds of years, but not in the form that most people know it, the pill form that you find in the pharmacy. In fact, it comes from plants, and we extract the active ingredient, salicylic acid, and put that into the tablets that you find in your pharmacy. In the past, people would chew the leaves, and that active ingredient delivered some benefits that people discovered over time. It reduces pain. It will also reduce fever. So we've been using it for that for a long time, and people still use it in the tablet form. But what else can you use it for? Well, medical guidance has been telling individuals with a risk of heart disease to take a baby aspirin, and also to give patients that are potentially suffering from a myocardial infarction. The guidance is, after you've called the emergency services, 911 in the US and other numbers in other countries, that you give them a baby aspirin. And in fact, the guidance is make sure it's a chewable one if you have it, because that gets into the bloodstream faster and it's helpful in reducing the risk from that heart attack. But the preventative service from aspirin has been questioned, and we're now thinking about this in different ways. But before we talk about that, let's go and look at the form of aspirin that we use for prevention of heart disease. So here's the pain relief aisle, and as you can see, it's pretty confusing. So there's lots of different pain relievers, and we're really focused at the aspirin. And aspirin you're going to find along with the Tylenols, Advils, and so forth. It can be hidden away, but you'll find that there's a number of vendors, and in this particular instance Bayer is well known for their aspirin, and what you're looking for is the low dose, and specifically the enteric coated. And what you'll see here is it says enteric coated, and look at the dosage. That's an 81 milligram dose. That's the low dose that you're looking for. There are other versions of this, and in fact you can find enteric coated versions that are higher dosage, but we really want the lower dosage if we're going to be taking this, although guidance suggests that you can take the higher dosage every other day. I personally believe that a lower dose every day is a better choice. So find the aspirin aisle, look for, in this case, Bayer, but here we're in CVS, and you can see they've got the same equivalent, and I'll tell you that 9 out of 10 doctors take the generic choice because it's the same drug, it's the same salicylic acid. So what's changed? Most people know that for the prevention of heart disease, taking a baby aspirin on a daily basis is a good thing. Well, it turns out this new study, large, wide-scale study, aggregating lots of data from different countries, different groups, many scientists involved, has actually shown up that there's really a question over the value of taking aspirin for the prevention of heart disease. So what are you to do? I'm confused, and I'm willing to bet that many of you are confused. So the answer to this question actually is very individual. It's impossible to give generic advice to everybody that's watching this and thinking about this choice. This is really a very thoughtful decision you need to make in conjunction with your primary care doctor, perhaps your cardiologist if you have a cardiologist, and something that you have to take account of the risks. The risks with taking aspirin, predominantly the bleeding, the enteric coated that we looked at, that actually reduces the overall risk of bleeding side effects. And the benefits, well, if you're not getting any benefits, you don't want to induce that risk, and whether you're going to get sufficient benefit will be determined by your risk of cardiovascular disease, and that's tied up to your blood pressure, whether you have hypertension, whether you've got obesity, your exercise. All of these other factors have to be taken into account. So my incremental guidance here is, first of all, go read up about this. So if you haven't thought about it, maybe you should. We believe that aspirin has some fantastic health preventative effects that would be very beneficial to people taking one on a regular basis. It's a relatively low risk drug unless you happen to be one of the unlucky people that suffers from a bleeding side effect. If you can take the enteric coated, you reduce that, but whether it's right for you remains an individual decision depending on your personal experience, your personal characteristics, and importantly, all your health status. So go have that discussion. In this instance, the incremental step for you is go have that discussion. Read up about it, learn about it. Look at the links that I've put in below. You'll see some of the details on how we've learnt about this drug, what it can do, and also the access study. And then go have that discussion with that information in hand with your physician so that you can have an informed decision. If I could ask a favor, if you like this video, please like it in the section below. And if you don't, leave some comments, let me know what I can do better. Otherwise, I'm Dr. Nick, and I'm the Incrementalist. Don't let perfection stand in the way of progress.